Okay, general pathology, starting now. What is, this whole thing is going to be about 2 words, limited to 2 words, equals and versus. Equals and versus. I'll say things either with equals or versus. When I say equals or versus, you fill in the blank. Inflammation versus neoplasia. These are the 2 main types of disease, the 2 biggest types of disease. Flip to the first chapter of your pathoma. What's it called? What's the title of the chapter? Cell injury. That's a preamble. Go to the second chapter. What's the title? Inflammation. Go to the third chapter. What's the title? Neoplasia. So inflammation versus neoplasia. These are 2 main categories. So Dr. Boyer is going to have you go through each organ system for each block or each thread of the course for pathology. And when you do an organ system, he's going to give you a bunch of lectures and review questions about all these non-neoplastic diseases, all these mostly inflammatory diseases, inflammation. Then at the end of that block or that little section or organ system, you're going to get lectures and review questions about neoplasias, cancers that affect that organ system, neoplasia. So it's always going to be inflammation versus neoplasia. Those are the main couple, the main pair. Once you have that down, you can add on extra. You can add on the D pair and the T pair. So the main couple is inflammation versus neoplasia. That's the most important. Get that down. Once you have that down, you can add on the D couple and the T couple. What's the D couple? Developmental versus degenerative. Developmental means it happens in development while you're in the womb. In other words, it means you're born with it. In other words, it means it affects babies, young. Degenerative means the body degenerates over time. So this is something that happens over the course of a lifetime from lifestyle things like diet, smoking, etc., etc. So this happens over the course of a lifetime, so it affects old people. So this D couple is all about time. On the other hand, the T couple is toxic metabolic versus traumatic. Toxic metabolic versus traumatic. Toxic metabolic is about things that you ingest into the body. Toxins, drugs, medications, poisons. And metabolic is also about things that you ingest into the body and what your body does with them. Metabolism. So it's about food. So it's all about things you ingest into the body, inside. Traumatic, on the other hand, is about physical damage that you take from outside the body. And I like to say traumatic structural, because that's also physical things, even if it's not outside the body. But the main point is inside versus outside. So this is about space. The T couple is about space, whereas the D couple is about time. Young versus old. Babies versus elderly. So the most important thing is to get this main couple, inflammation versus neoplasia. These 2 categories are the foundation of all of pathology. Period. Once you're very comfortable with those, then you can add on and start thinking about these other 2 couples, space and time. If you know Einstein and the stuff, the physics stuff, he talked about space, time a lot. That's like the 2 foundational components of the universe or whatever. So I like that phrase, space-time, because in med school and medicine, you're going to be thinking a lot about those 2 things. Location, which is space, and time, timing and age. Those are 2 very important things, and they're not going to tell you to think about that. When you're reading the question, you have to know for yourself to think about that. So that's why I like this phrase, space-time. Okay. And then there's one last category. So I said it was 3 couples, but I kind of lied because there's a 4th thing. And I never put things in the middle of this triangle. The whole point is supposed to be that it's 3 sections. It's like this versus this, and then the odd man out on top. But this is the one, when it comes to this pathology framework, it's the one time where I put something in the middle because of something that wasn't included in what I had, and it's vascular. So I say vascular referring to blood vessels, but I also use the term loosely here to refer to blood vessels, blood in general, hormones which flow in your blood. That's why they're called endocrine. Endo means inside the blood, whereas exocrine is outside the blood. So endocrine stuff, I put it all under this word of vascular. Why do these things group together and why are they so important of a category? They're super important, so I put them in the middle. Very important. It's the most important thing after inflammation versus neoplasia. Why is vascular so important? Because it has to do with blood. Blood flows all throughout your body. So that means when something is in your blood, it affects your whole body, not one specific organ system. It's systemic, not local. It's systemic. So this vascular category is all referring to all the systemic type of diseases. So this is how I organize Dr. Boyer's framework and algorithm he gives us for differential diagnosis. Basically, if you think of these categories when you're dealing with an organ system, that will trigger you to think of a potential diagnosis that falls into each category and help you to build a broad differential. And it's really helpful just to categorize things and remember things as you're learning them too. So this is the foundational framework for pathology. But the most important part, again, is the main couple, inflammation versus neoplasia. And then I should say, under inflammation, the I, it splits into the two causes of inflammation. It could be infectious, IN, or immune, IM. Infectious means it came from an outside source, right? A microbe came into your body and caused this inflammation as a response. Your body is causing inflammation to fight the microbe. Versus immune means it comes from within. Your body is attacking itself with inflammation for no reason. So in infectious, whose fault is the inflammation? The infectious agent. It's their fault. In immune diseases, whose fault is the inflammation? It's your immune system that's causing it. I use that word immune loosely to refer to non-infectious inflammation. So hypersensitivity, autoimmune diseases, allergies, right? Any immune response that's not being caused by an actual infection, it's just your body doing it. That's what I call immune. So I splits into that too. And then, of course, neoplasia. Since I did this, I'll just add that too. Neoplasia splits into benign versus malignant. That's a really important split, right? I said neoplasia is cancer. That's technically not true. Neoplasia means new growth, neoplasia. And only the malignant ones are actually cancers. A benign new growth is not a cancer. It's just a tumor, just a benign tumor. Okay, so that's the important split for neoplasia, benign versus malignant. This is a framework for all pathology. Okay. So the first organ system you're going to have is heme. Heme is all about blood. But actually, it's only about one component of blood. So your blood has two components. Solid versus what? Liquid. Solid versus liquid. Liquid versus what? Solid. Liquid versus solid. The two components of blood. This is very important. What is the liquid component of blood called? It's called serum. What is the solid component of blood called? It's called cells. You may have said red blood cells. That's not a bad answer, but the real answer is cells, because there are multiple types of cells in your blood. So let's talk about the serum, the liquid component of blood. First of all, blood, it's not blood if it does not have these two components, solid and liquid, serum and cells. It's not whole blood if it does not have these two components. Because there are products, blood products you can give to people, but they're not necessarily whole blood. Okay, let's talk about liquid. Serum. What does it have in it? It has these small little things, little proteins floating around in it. But I don't call them solids. I don't call those proteins solids because they're so small. I don't count them as solids. I put them on the serum side of things because they are floating around in your serum. When you give somebody serum, you're also giving them these proteins. What are these proteins? They're antibodies, coagulation factors, albumin, all these little things like that. What do they have in common? They're all proteins. So your serum, the liquid component of your blood, has proteins in it. What about the solid component of blood? What's the solid component called? Cells, specifically blood cells, right? Because they're in your blood. There's 3 types of blood cells. What are they? Red blood cells. What's the next one? White blood cells. And what's the next one? Platelets, right. Platelets, I like to call them pink blood cells. Are they actually pink? No. I just like it because it's in between white and red. Okay? So you have cells and serum, the 2 components of blood. Serum has proteins in it. And cells, there are 3 types. And it's a nice triangle. You have your red blood cells, your white blood cells, and your pink platelets. PP. See, it's very nice. They're not actually pink, but that's how I do it. Red blood cells, white blood cells, and pink blood cells. Or if you want to be official, red blood cells, white blood cells, and platelets. These are the 3 types of cells. The thing is, when you're talking about heme, you're mostly, not even mostly, you're basically referring to the solid component. Yeah. I mean, I think Boyer's going to teach you about serum too. It's going to teach you about blood products and how if you give somebody serum and that serum has antibodies inside it that are, reacted to that person, then the antibodies in that serum can attack that person. So you have to make sure you're giving people the right kind of blood if you're giving them whole blood that contains both cells and serum. So what are the things that serum contains? Antibody, albumin, and coag factors. Probably some other things that I don't really care, or it's not at the top of my mind, because this is not the main point anyways. So you have 3 types of cells. What are the purpose of these 3 types of cells? What's the purpose of red blood cells? Feeding. They feed the tissues of the body. They are delivery men. They carry oxygen and food to the various tissues of the body. They are delivery men, feeding. What about white blood cells? What's the purpose? Their purpose is fighting. White blood cells fight infectious agents. So you have delivery men versus fighters. It's like 2 opposite members of society. The ones that create things and the ones that destroy things. The ones that are nurturers and the ones that are like just protectors. Then the odd men out in the triangle, you have the platelets. What's their job? They form platelet plugs. So it's coagulation, right? No, it's not coagulation. They only do the first step that prepares you for coagulation. They do primary hemostasis. So hemostasis, which is a process that means blood stopping, it's how you stop bleeding and form a clot, or by forming a clot. It has 2 steps, primary versus secondary hemostasis. The primary is platelet plug. You form a platelet plug. The secondary, which is the final step, that's how you finish it off, you form an actual clot, okay? A platelet plug is just preparation for a clot. So it's all about P's. Pink platelets form platelet plugs in primary hemostasis. P. I don't know how many P's it is, but it's very nice how it all fits with P. So it's all about P, like the letter. We're not on renal yet. So, platelets do primary hemostasis versus who does secondary hemostasis? It's the coag factors. The coag factors that actually happen to be over here. Okay, they do secondary hemostasis. They form the actual clot. They're bigger. They're like, actually, are they bigger? I don't know, it doesn't matter. They form the clot, okay? So the platelet plug is like a scaffold or a rough draft for the clot. Then you're going to build on top of that platelet plug to form the actual clot. Okay,